World Diabetes Day 2024. Every November 14, World Diabetes Day is commemorated. This is an opportunity to raise awareness about the impact of diabetes on people's health and to highlight the opportunity to strengthen the prevention, diagnosis, and treatment of diabetes. This year's theme, Breaking Barriers, Bridging Gaps, underpins our commitment to reducing the risk of diabetes and ensuring that all people diagnosed with diabetes have access to equitable, comprehensive, affordable, and quality treatment and care. Join us in raising awareness, spreading knowledge, and creating lasting change for all affected by diabetes. The key facts about diabetes. Type 1 diabetes is not preventable. Type 2 diabetes is often preventable through a healthy diet, regular physical activity, maintaining normal body weight, and avoiding tobacco use. Diabetes is a major cause of blindness, kidney failure, heart attack, stroke, and lower limb amputations. Diabetes can be treated and its complications avoided or delayed with regular screening and treatment. People with diabetes should seek regular screening for complications to aid in early detection. This includes screening for kidney diseases, regular eye exams, and food assessment. Quitting smoking reduces the risk of developing type 2 diabetes by 30 to 40%. Diabetes is associated with about twice the risk of tuberculosis disease and a higher risk of multi-drug resistant TB. People with both TB and diabetes are twice as likely to die during TB treatment and have twice the risk of TB relapse after treatment completion. Only about 50% of people with type 2 diabetes get the insulin they need, often because their country's health systems cannot afford it. Why is diabetes important? Worldwide, the number of people living with diabetes has increased from 108 million to 420 million in the last 30 years. 62 million people with diabetes are in the region of the Americas. This number has increased over threefold in the region since 1980 and could be even higher since 40% of people living with diabetes are unaware of the condition and undiagnosed. The burden of disease associated with diabetes is enormous and growing. In just 20 years, the diabetes mortality has increased by over 50% worldwide. In the region of the Americas, it is the sixth leading cause of death and the fifth cause of years life lost prematurely. In the region, diabetes, including diabetes related kidney disease, causes approximately 8 million years of life lost each year due to premature death. Diabetes is currently the third leading cause of disability, that is DALIs, preceded only by ischemic heart disease and COVID 19. Why is it difficult to control diabetes? The expansive growth of the diabetes epidemic goes hand in hand with the increase in its risk factors. The Americas is the region with the most overweight or obesity and physical inactivity in the world. 68 out of 100 adults are overweight or obese, and 36 out of 100 people have an insufficient level of physical activity. The increase in risk factor for diabetes is alarming in children and adolescents. 16 out of 100 adolescents and 19 out of 100 children are obese, while 81 out of 100 adolescents practice insufficient physical activity. People living with diabetes face different barriers to accessing healthcare. Treatment for diabetes and its complications can be costly and often require high out of pocket expenses. Insulin is crucial to sustain the lives of people with type 1 diabetes and many with type 2 diabetes. In many countries, diabetes care is not included in universal health coverage, and there are gaps in primary health care services and access to other care levels. What can we do to control diabetes? Halting the rise of diabetes is possible and goes hand in hand with implementing strategies such as prevention of diabetes and its risk factors, especially overweight or obesity and insufficient physical activity. Screening for diabetes in the general population and closely monitoring the population at risk. Improving the diagnostic capacity of health services for diabetes, continuous monitoring of people living with diabetes, the capacity for referral and care at the secondary health care level. Access to quality diabetes education guarantees adequate training for the healthcare team, people living with diabetes, their immediate environment, their caregivers, and society in general. Access to essential diabetes medicines and technologies, including insulin. Information systems for data collection for monitoring and surveillance of diabetes.